try to do a little of is in the back sections with the correlation and critical application is to give you ideas when you can use them. So basic adjusting guidelines are here. So this uses part of the analysis to determine what cranial bones are in stress, where they are, and then just very basic adjusting guidelines for you to start from to get a sense of where to make your first correction. So it's all the stuff we talked about. We talked about putting the information correction in extension. We talked about using the visual analysis about a press time. And this part we talked about where the palpatory pain is on which fontanelles. That gives you again an indicator for which cranial bone is out of alignment or is subluxated. So when you're looking at specific cranial bones, you will do the techniques we learned mostly yesterday, except for the frontal. Those are ones to adjust specific cranial bones into their normal relationship. The other techniques, like I said, are more global. The only difference is the CSF balancing techniques I tend to use after I've made my cranial corrections, as opposed to prior to that, because I want to balance the CSF through the system after I've changed the duromeningeal structure underneath it. When clearing cranial subluxations, as I said earlier, so like the primal brain mode or the occiput in pediatrics, again, the sphenoid basal always comes next between that. And then also, you put a little note here, this midbrain also is affected, the temporal lobe also affects that midbrain level. And then finally, the higher level function of the frontal. So this is the way you want to. Now, that doesn't mean every time the patient comes in, you have to correct their occiput. That means just like if a patient comes in, if you do upper cervical work, and you correct their atlas every time they come in, you recheck them, and the atlas is not subluxated, you don't go do the correction again, right? You leave it. Same thing with cranial. If you come in and their occiput's clear, you don't go on and do the occiput stuff again. It's like you move on. That's the whole idea of changing patterns in the spine is finding where the subluxations are, removing them or reducing them, and moving on from there. changing the occipital, temporal, and frontal, then you're changing the journey, you're changing the range of motion, changing the range of motion. You want to make sure that you get spinal fluid and get the flow directly. So that's why we do use the handle technique. In your case, you're starting from frontal molding, because we didn't teach you the intraoral for that. You're doing the frontal molding technique, and then these techniques can help balance that out. The reflex stimulation, again, asthma and sinusitis. You can do all three of these on one visit. It's okay, they're very quick. They do help drain the sinuses quickly. If you have a TMJ problem, these are just some of the techniques that work with the TMJ problem. When we're not evaluating, the TMJ actually is a very complicated issue, especially because it has three ranges of motion. It has occlusion, it has rotation, it has translation. So there are different factors within how the TMJ functions that makes a difference. But in a general case, if the patient has some TMJ issues, or if they have, or they're teething issues, or they're clenching or grinding, or the dentist has told the parents that they're going to need $5,000 worth of orthodontia work in the next week. These are the kind of things that you can do to help balance the TMJ. You won't deal with the specific issue, but you will be able to balance it. That's our little friend.